Hi, everyone. My name is Dr. Rose Grose. I'm Assistant Professor of Community Health Education in the Colorado School of Public Health at the University of Northern Colorado. My PhD is in social psychology, and I was a Satcher Health Policy Leadership Fellow and a Gender, Family, and Global Health Postdoctoral Fellow before starting at Colorado SPH in 2018. You can follow me on Twitter or contact me via email. My overarching agenda is to improve sexual health through research, education, and advocacy. At Colorado SPH at UNC, we mostly focus on teaching and advocacy. In addition, I study gender, power, and sexuality to inform policy, evidence-based programs, and collective action to reduce sexual health disparities and promote gender equity. My expertise is in mixed methods research, understanding social determinants and structural influences on sexual health, and evaluation of community-based programs. I'm going to quickly highlight 4 current projects. The first relates to first-generation college students' sexual health. Alongside 3 Colorado SPH students, I'm examining first-generation college women's sexual education, knowledge, self-efficacy, assertiveness, and risk. Our data were collected for my dissertation at UC Santa Cruz, and we'll be presenting our findings at the Society for the Scientific Study of Sexuality annual conference in San Juan, Puerto Rico. We also have a manuscript in progress. What little research exists in this area suggests first-gen students may be at risk for negative sexual health outcomes. We had a large sample 4-hour analysis and found most differences by first-gen status actually disappeared when we accounted for other identities. First-gen students still reported less access to sexual information and support resources, even after accounting for ethnic, sexual, political, and religious identities. Several team members are first-gen students themselves who can help us fully understand the implications for education, advocacy, and future research. The second project is about a mindfulness-based intervention for lesbian, gay, bisexual, and transgender and queer adolescents. Alongside an interdisciplinary research team from across the 3 Colorado SPH campuses, I'm helping to adapt Breathe Q, a mindfulness-based intervention for LGBTQ+ youth. We're supported by a Department of Community and Behavioral Health pilot grant and partnerships within the community. We'll present the first phase at the American Public Health Association annual meeting. To date, there is no MBI that addresses LGBTQ+ specific stressors, even though this group faces minority stress and mental and physical health disparities. An MBI may help them learn breathing techniques, explore ruminative thoughts, identify emotions, unpack stress, and practice coping skills. With an adolescent steering committee and focus group insights, we will adapt the intervention, format it for telehealth delivery, and assess its feasibility, acceptability, and safety. The third project is an analysis of Georgia Equality's Youth HIV Policy Advisors Program based out of Atlanta, Georgia. I started this collaboration between Georgia Equality and Morehouse School of Medicine as a postdoc intern and continued it at Colorado SPH. We have a manuscript currently under review. YHPAs are young people ages 18 to 30 living with HIV in Atlanta and willing to disclose their HIV status. The paid program equips them with HIV knowledge, policy analysis and advocacy training, communication and leadership skills, and community support. We conducted a mixed methods post-evaluation survey of 91% of alumni from the first 3 cohorts. The YHPA program increases the meaningful involvement of people living with HIV in local policy decisions, establishes a policy-savvy network of young people living with HIV, and educates elected officials about how HIV affects youth. The fourth and final project is the Resilience in Transgender Youth Study. This project is led by the Centers for Disease Control and Prevention's Division of Adolescent and School Health and ICF in Atlanta, Georgia. I joined the large team of collaborators as a postdoc intern. We have published 1 journal article about transgender youth experiences with healthcare and have 1 about their experiences with sexual health education under revision. This is a formative qualitative study conducted with a diverse group of transgender youth in the southern United States. The study assesses protective factors such as individual attitudes and behaviors, relationships, school environments, sex ed, medical care, and local organizations and events. A major strength is that this study highlights youth voices about how they want to be served and how we can address physical, mental, and sexual health disparities as public health professionals.